In the meantime, the race for a cure is on, and some doctors and hospitals are implementing a new treatment using an old drug. One America's Jack Posobiec has those details.
According to a new report from the Wall Street Journal, doctors in South Korea, France, and the United States are now utilizing an anti-malarial drug approved all the way back in the 1940s by the FDA, known as hydroxychloroquine, on patients infected with COVID-19. And it is showing effects that are giving hope to doctors and the public around the world. Although I want to caution that we are still in the early stages of this testing and rollout. But according to Dr. Jeff Collier, chairman of the National Advisory Commission on Rural Health, and Dr. Daniel Hinthorn, director of the Division of Infectious Disease at the University of Kansas Medical Center, hydroxychloroquine is a common generic drug used to treat lupus, arthritis, and malaria. The medication is relatively safe, with the main side effect being stomach irritation, though it can cause echocardiogram and vision changes. In 2005, a Centers for Disease Control and Prevention study showed that chloroquine, an analog, could block a virus from penetrating a cell if exposed before exposure. The tissue had already been infected, then the drug inhibited the virus. On March 9th, a group of researchers in China published preliminary results showing the hydroxychloroquine treatment had a positive effect against the 2019 coronavirus. A more recent French study used the drug in combination with azithromycin. Most Americans know azithromycin as the brand name Zithromax or Z-Pak. However, the doctors caution that the French study was only conducted on a limited number of patients. In many hospitals on the front lines of this fight, the medical cocktail is already being prescribed for patients and medical professionals. Several large drug manufacturers are also pledging to turn over their production facilities to crank up production of this drug. The WHO announced a multi-country study this week of drug treatments, one of which is chloroquine. Further still, companies such as Gilead Sciences, Regeneron Pharmaceuticals, and Sanofi are testing other drugs such as antivirals and lung anti-inflammation treatments as other vectors of fighting the virus outbreak. As the race for the cure continues, researchers and hospitals are keeping a close eye on any drug that shows results against coronavirus. For One America News, I'm Jack Posobiec.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.